My name is Gianna Veda, and this is my partner, Rose Minnie. We are part of the 2019 Rare Disease Day and got the opportunity to do some fundraising and research on the disease Paley-Zayas-Merzbacher disease, also known as PMD.
PMD was first described by Paley-Zayas in 1885 and then by Merzbacher in 1910. It is an X-linked genetic disorder that is shown in males and carried in females. The reason for this is that females have two X chromosomes, so they are able to cancel out the disease. Males, on the other hand, have an X and Y chromosome, so they are unable to do so. PMD affects your central nervous system and is a hypomyelinating disorder, meaning that there is no normal myelination. Myelin is a protein that wraps around neurons in the brain that allows faster nerve impulses. In the U.S., 1 in 200,000 to 500,000 people have PMD. PMD can be diagnosed when it is noticed that there is a mutation in your proteolipid protein 1 gene, also known as the PLP gene. PMD can cause a neurodevelopmental delay, meaning that you process things slower, and hypotonicity in infants, meaning lack of muscle tone. Symptoms can start at 3 months, which is when the myelin starts to diffuse away. PMD is a progressive disorder and classified as leukodystrophy, meaning it is a condition involving abnormalities of the nervous system's myelin. PMD is also conatal, meaning that the myelin is completely absent in the central nervous system. This was proven correct when central nervous system's proteins were extracted from PMD patients. There are 3 types of PMD: classic, conatal, and transitional. Conatal is fast, severe, and fatal as an infant. Transitional is a mix between classic and conatal. PMD is a result of 1 in at least 85 mutations of DNA. Symptoms include muscle tremors, weakness, facial grimacing, lack of muscle tone, struggle to coordinate voluntary movements, and you're quite dependent upon your caretakers. PMD can be diagnosed through family history or tests like an MRI to show that there is a deficiency of myelin.
Based off of our interview with the family, we learned a lot of valuable information that we would not have been able to attain through the internet. We learned that our patient was clinically diagnosed in June of 2005 and then officially diagnosed through a blood test in August of that same year. A normal day for the patient consists of him getting his diaper changed, he is assisted with getting dressed, moved into his chair, he brushes his teeth, and then heads on the bus for school. If he is not going to school, he spends the day at his CNA's house where he is able to spend time with other children. When we spoke with his mother, she informed us that the most difficult part of her day is getting things done when all of the attention is driven to her son. Luckily, he does not need to be admitted to the hospital often unless a surgery is required that can help him. Some medications that he takes can include baclofen, which is a muscle relaxer, a daily vitamin, which promotes healthy lifestyles, Duocal, which provides him with extra calories, and Miralax, which is a gentle laxative. The patient also uses an activity chair, wheelchair, and AFOs. He does attend a regular middle school. He is in 8th grade, and at school, he receives physical therapy, occupational therapy, speech therapy, and vision therapy. He is a smart kid, but is unfortunately at an elementary school level. Concerns from his mom is that what would happen if something were to happen to her in the future? Who would take care of him? She also worries what will happen when he gets bigger. She also worries that her house is not accessible enough for him. She wishes that her house was more accessible and that she also would have access to a wheelchair van.
Next, we did our interview with our researcher, Dr. Grace Hobson, and she was able to provide us with a lot of great information on PMD. Currently, the treatment for PMD is palliative, meaning that it helps aid spasticity. Research is being done to alter DNA to prevent the duplication of the gene. Dr. Hobson heads a research lab where she collaborated with other researchers on what can be done to understand the genetics of PMD. Translation research, according to Dr. Hobson, is to do research where the focus is to take it from research into something that directly benefits the patient. At Nemours, they do molecular diagnostics. They used to be the only place to do molecular diagnostics for PMD patients. PMD is not a growing disease, but the number of people being diagnosed is, because there are more clinics that are able to do so. A hospital stay is not necessary when you are diagnosed with PMD, but may occur when getting very sick with something like pneumonia due to your compromised immune system, causing you to not fight back as easily. Dr. Hobson believes a treatment will be found for PMD, but a cure right now does not seem to be in the future.
After we conducted research, spoke with a researcher, and spoke with a mother that has a child with PMD, we came to the conclusion that a possible cure for the disease would be a way to alter DNA. As technology advances, we believe that this would soon be possible. Altering DNA would prevent the gene from being inherited by offspring. We believe that possible treatment for the disease can include physical therapy, antispastic therapy, which would prevent spasms, and orthotics.
In conclusion to all the research we have done and information we have obtained, PMD is rare, progressive, and degenerative central nervous system disorder. It affects your coordination, motor abilities, and intellectual functions will deteriorate. PMD affects lives of families all around the world, and cures and treatments are the main priority for our researchers today.
After concluding with our project, we would like to thank everyone that stood by our side and helped us along the way. We especially would like to thank Dr. Enslin, Dr. Hobson, the researcher, the patient and the family, our teacher, Ms. Sapienza, and our family and friends who helped us with the fundraising. We had a lot of fun during this project and can't wait until February 28th.